International Cancer Institute, ICI, located in Eldoret, Kenya, is a non-governmental and non-profit organization whose main aim is to provide specialized services along the continuum of cancer control and care, enhance education and training opportunities, and expand research for congruent management across the Sub-Saharan African region through relevant multi-sectoral collaborations and partnerships. The ICI Care and Research Clinic is an accredited European Society of Medical Oncology designated center for integrated oncology and palliative care services. Cancer and hematological conditions are public health problems, bringing various levels of morbidity, disability, mortality, and economic hardship. As per WHO's GloboCan, close to 800,000 number of new cancer cases were diagnosed in 2020, with 520,000 deaths reported in the same year in the Sub-Saharan African region. Looking at an example of sickle cell disease as a hematological condition, close to 300,000 children are born with it yearly, with 75% of cases in the Sub-Saharan African region. Cancer and hematological conditions are chronic illnesses, meaning there's long latency periods and long frequent treatment visits. With this, looking back at public health settings where many of us have been, with the long queues, we cannot spend so much time with the patients, and this is understandable. As much as we want to spend time with them, there's others waiting. A larger number might improve this. In countries like Kenya, most health specialists are concentrated in cities, whereas a large proportion of the population reside in suburban and rural areas, having inaccessibilities to such and constraining factors to constantly travel. According to a study analyzing the aortic network, the recommended standard number of healthcare providers is low, overworked, and this has collateral damages. Recommendations from studies have been to improve provider-to-patient ratios and develop new models of capacity building, retention, and skill enhancement to strengthen care systems. ICI tried to address this, especially the lack of untrained healthcare workers and diagnosis, by introducing 1. Online clinical and non-clinical preceptorship courses, 2. Virtual tumor boards, and 3. Digital pathology, all through technology. Looking at the cancer continuum, courses are developed on the components, such as clinical courses on primary prevention through advocacy, secondary prevention on screening cancers amenable to so, tertiary prevention on treating precancerous and early cancerous lesions, chemotherapy administration, disease-specific, definitive, supportive, and palliative care, and then also crucial non-clinical courses such as data management, health communication, project management, grant writing, and biostatistics.
ICI provides various clinical and non-clinical education and training programs which are tailored for healthcare professionals who are involved either directly or indirectly in the multidisciplinary care of cancer patients. Our programs are generally innovative courses that offer an enriched learning experience with an emphasis on interaction with fellow participants and faculty, and aim to support the implementation of scientific advancements with the ultimate goal of improving cancer care services. Our courses generally provide trainees with robust knowledge that cuts across from epidemiology, pathophysiology, clinical presentation, diagnosis, treatment, as well as palliative and survivorship care, and they are well suited to the needs specific to oncology practices in Sub-Saharan Africa.
So we are here to learn and to get more training in terms of oncology ailments and how to manage them. The advantage that we do have by learning this program is because we are coming from the setting that the oncology is a specialized wing, so we are unable to actually see these patients on time and manage them in our district hospitals. So the program is actually capacitating the medical officers to be able to pick up these cases, to screen them, and how to manage them.
The duration for preceptorship courses typically ranges from days to weeks to months. Courses are accredited by professional bodies and include CPD points. ICI holds bi-weekly multidisciplinary virtual tumor boards, VTBs, on Mondays and Thursdays, where content experts share standards of care and discuss cases from various affiliated centers and also have topical discussions. Apart from formulating the best management plan for individual patients, these VTPs offer an opportunity for participants to undergo continuous education, networking, and mentorship. For preceptorships, technology was expedited from recruitment of participants through various platforms, registration, communication, session conduction, reviewing of resources, examination.
Cancer diagnosis is based on quality histocytopathology. As a result to this, International Cancer Institute Laboratory has introduced digital pathology, which is integrated with artificial intelligence tools. This is an essential component of telemedicine which aims to improve access to pathology diagnostic services, both locally and internationally. In addition to this, digital pathology provides slide banks for research, platform for tumor board discussions, and also case for conferencing amongst pathologists. So besides, digital pathology improves access to pathology services in resource-constrained settings and reduces reporting turnaround time.
The research was a retrospective descriptive study where both quantitative and qualitative data was collected from forms, reports, and surveys from the year 2020 to 2022. A census non-probabilistic purposive sampling was used, where records were recruited, analyzed, and diagrammatically processed using both a univariate and multivariate approach. For preceptorships, there were close to 500 registrants, with the majority of them being healthcare workers, but from different healthcare cadres. The others included administrators, advocates, and even patients and survivors, which was really heartfelt. More than 90% actually registered for clinical courses, and a majority actually enrolled or were recruited from the various digital social media pages and other platforms. Participants for both preceptorships and VTBs were from the Sub-Saharan African region and beyond, with a whopping 76,000 registrations made for VTBs over the years stated. So registrants always had the chance to explain and relay their levels of education and discipline, and clarification attempts were frequently made or attempted. Jargon levels were always tailored relative to the audience and participants involved so that communication could be achieved. In relation, an outstanding 92% of expected outcomes were met, and several participants actually reported practice and implementation of information learned through the various forms of education into their current areas and places of work. Many participants also continued joining in for the VTBs for further mentorship and respective care formulation for their patients. So time constraints and convenience could be respected. And with clinical, educative, and research areas, the schedules vary. Resource management and references were also relayed for further interests. Such programs can inspire others to pursue higher levels of education, also get mentored, and also destigmatize the bad views in oncology and hematology. And such programs could be entry points for masters and fellowship programs in oncology and hematology. Learning from the use of technology for education and training can also be translated for patient care and navigation. Patients can learn about their conditions from patient-friendly sources available online, use telemedicine for relaying distressing symptoms, concerns, renewal of prescriptions, etc., telepathology and teleradiology, all for diagnosis and treatment, can find facilities of excellence and specialists from contacts availed, follow up with their electronic records electronically so that there is enhanced mobility, trackability, and integrity. Use medical devices with range parameters that send out warnings when out of range. Use calendar systems for reminders and schedules so that all is time-minded and there's seamless transitions. And finally, use networked support, online support groups for sharing coping mechanisms and inspiration. In conclusion, the high burden brought by these diseases requires innovative and novel approaches to bridge deficits in control and care health systems, and also enhance primary health care centers where many patients visit before seeking care at specialized centers. There is definitely still need for consultant supervision and higher level programs on top of these educative courses. But the study or rather model demonstrates how the use of digital technologies can be used in various approaches and also act as a baseline for future initiatives if pursued. Thank you.